And here are the doctors.
Here we are.
Before we do our introduction, let's just give a big shout out to all the nurses out there.
Yes.
It is Nurse Appreciation Week, so.
Woo!
Good job, nurses.
I am Dr. Stacy and I specialize in emergency medicine.
My name's Dr. Allie and I'm the OBGYN of the group.
My name is Dr. Jen and I am the plastic surgeon of the group.
And I am Dr. Allie, and I am the pediatrician.
All right, today our topic is pancreatitis. Pancreatitis is inflammation of the pancreas. The pancreas is an exocrine and endocrine organ. It regulates digestion and sugar by excreting enzymes. Audience, do you know where your pancreas is located? No.
What's a pancreas?
Well, right here is your pancreas.
We've got the pancreas is a long, flat gland that sits tucked behind the stomach in the upper abdomen.
There are two types of pancreatitis. There's acute and there's chronic. Acute is more life-threatening, whereas chronic is kind of asymptomatic until about 80 to 90% of the gland is destroyed.
So, does anybody have any questions?
She drinks a lot. Is she at risk?
Yes.
Yes, she is.
Alcohol, or excessive alcohol use, and gallstones are actually two of the major causes of both acute and chronic. What? Acute and chronic.
Other causes can be previous abdominal surgery, certain medications, cigarette smoking, cystic fibrosis, increased calcium in the blood, increased triglyceride levels, and pancreatic cancer.
You also might wonder what the symptoms of pancreatitis are. For acute pancreatitis, symptoms include severe abdominal pain that will radiate to the back, abdominal distension, hypoactive bowel sounds. It will cause a fluid imbalance, which will lead to a decrease in your blood pressure, hypocalcemia, and if you have an obstruction, you can be jaundice. For chronic, besides the symptoms I just listed, you will also be anorexic, nauseous, have vomiting, constipation, excessive passing gas, and as the disease progresses, the symptoms will include diabetes and malabsorption syndrome.
Any questions, audience?
What's the treatment for pancreatitis?
That is a very good question, audience. Well, we have the initial goal of treatment is to treat the symptoms. You can also treat it with pain control and palliative care, other medications to decrease pancreatic secretion and activity, which would include Tragomet or Zantac, and you could also use surgery to remove the obstruction as treatment.
Any questions?
Okay, let's see if we have any calls.
Look at that!
Oh, it's Nurse Bree. Hi, Bree. How are you?
I'm good. How are you guys doing?
Good.
We are fabulous.
After this, I was wondering, what labs should I be looking at for pancreatitis?
What lab should you be looking at?
That's
That
a
is
very good question.
You need to be checking the amylase levels, which will rise within 24 hours of onset and remain elevated for 48 to 72 hours. Also look at the lipase levels, which will elevate for the first 24 to 48 hours and remain elevated from 5 to 14 days. You also want to look at a CT scan, an MRI, and also abdominal and endoscopic ultrasounds.
Does that answer your question, Bree?
Very good. Thank you so much.
Thanks,
You're
Nurse
welcome.
Bree.
We love you, Nurse Bree. All right.
Does anybody have any other questions?
Nope.
Well, that just about sums up our topic of the day.
And we will see you tomorrow.